Hi, my name is Dalton McKittrick. I'm 16 years old, and I have USH 1B, along with my 25-year-old brother, Connor. I'm pleased to announce our next speaker, Carmen Trupek, a family friend and a Coalition's 2024 Foresight Award recipient. This morning, you heard my mom talk about Carmen's achievements, what she means to our family, and her commitment to the Usher syndrome community. Thank you, Carmen. As the Senior Director of Scientific Programs at Global Genes, Carmen builds partnerships and programs to maximize data collection and sharing for rare disease communications. During the RareX platform, Carmen has specialized in inherited eye diseases for over 20 years, in roles spanning academia, telemedicine, and nonprofit organizations. At Informed DNA, she advocacy-based sponsored genetic testing programs. As a consult to Spark Therapeutics and the Foundation Fighting Blindness, she also spent more than 10 years serving the board of directors for the Usher Syndrome Coalition and our family's nonprofit, the Here See Hope Foundation. Please help me welcome Carmen.
How amazing is that? I could not have possibly imagined. I knew Dalton basically from the day he was born and was there the day his older brother was diagnosed, and it's kind of phenomenal to think about him here today becoming a really active patient advocate in his own right and introducing me. So thank you, Dalton. So I get to talk today about a project that for me has really become kind of a full circle of efforts and work that I've had the privilege of being able to do really hand in hand with Usher syndrome patients and families and the larger community. And that is the data collection initiative that we are doing collaboratively. So just right off the top, I work for Global Genes. Global Genes is a global kind of umbrella patient advocacy organization. We are a nonprofit. We offer lots and lots of support to patients and families with all kinds of rare disorders. Within the Global Genes larger organization, or it's not a big organization, but within that organization, RareX is the research platform. So sometimes there's a little confusion, like, do you work for Global Genes or RareX? Both. RareX is just our research program. So our research program really exists to be able to collect data directly from patients and families, to take the experience that individuals have with their rare disease and make that available in a really quantitative research grade way and make it available on an open science platform. So essentially, our goal is we want really solid data coming directly from patients and families, made widely available to support researchers and not having it housed sort of one study at a time. So we're open to collaboration with all kinds of different stakeholders, and you'll hear about a couple of those. This is sort of broadly, we partner with over 100 different patient advocacy organizations. And within that, we do partner with a couple that are very specific to Usher syndrome. Oh, and if I went back, I think I can go back, actually. Yeah, we do currently collect data from 90 countries around the world, so it is a truly global platform with the privacy in place to be able to support both data collection and data sharing globally. Okay, so very specific to Usher syndrome. I'm going to go through some of the results that have started to come out of this research study. This is an IRB-approved research study, but it is one that is available to any of you, if you are a patient or a family member, to be able to participate in from home. So part of our goal here is to really make research easier for individuals to participate in, For a lot of families, it's very difficult to get to a large academic medical center and to be able to participate in those studies there. If you can do that, you should do that. Those studies are amazing, and this is not meant to replace them. But for so many patients and families, that's a difficulty. But your data can still become part of what we learn about Usher syndrome and what we're able to share. So we have been working together with the Usher Syndrome Coalition, with the Usher Syndrome Society, to kind of get the word out that we are doing this data collection initiative collaboratively together. Currently, we have an enrollment of 239. I think actually it's a little bit more than that because a few people have stopped by that back table and enrolled today. But when I put this together like a week ago, it was at 239, just a little over half female. And this is an age breakdown, which I think is really important because if you look at these different bars across, and I know that's probably difficult for some people to see the granularity of it, but if you look at those bars across, these are age ranges, under 5, 5 to 10, 10 to 15, like that. So you can see that there are many, many, many adult individuals who are captured in this, and that's really important to us to capture the entire life spectrum experience. You just heard a little bit about like what we know broadly as a clinical genetics community about the breakdown of Usher syndrome within the data collection program right now, and this is only based on 62 individuals. The reason for that is that we developed this particular survey just a few months ago and put it on. So really, of those 239 people, if you're one of those 239 people that signed up but hasn't done this survey, this is important to do. So one of the things that we're seeing is that, type 2 Usher syndrome, we all know is the most common type of Usher syndrome, but currently in the data collection program, it's the most common by a lot. So we're a little bit underrepresented currently for type 1. So that just means that lots of the parents in the room, like your perspective on your child and their experience is really critical in this effort. When we look at the other two, this is type 1 and then type 2. So within type 1, we currently have an equal number of individuals in the platform with myosin 7A versus CDH23. Again, this is a little bit of a skew. We would expect to see a little bit more of myosin 7A. So as this program grows, we will start to see more and more of this. And this is super critical. Capturing this information is really, really important because this is the number one question that drug developers ask is, can you tell us the number of individuals with this specific type of Usher syndrome? Because as you've heard a lot today, so many of the therapies being developed are gene specific. And so they want to know, do you have an engaged, ready patient population with genetic variants in this particular gene? And this kind of initiative enables us to be able to say, yes, absolutely. We would like to say by the end of the year that we have double at least these numbers, and we know exactly the breakdown of them because that shows those drug developers, not only do we know broadly what percentage of individuals have type 1, and in type 1 specifically which genes, same for type 2 of course, but also this is an engaged, excited, willing population that we can reach. Dr. Jen Lenz, she mentioned earlier that one of the things that we do in this data collection program is we don't ask just specifically about vision and hearing. We really ask in a very kind of global, agnostic way about any kind of symptoms that might be affecting an individual's health or their quality of life. And there are a couple of interesting things that have come out of this. One, I think, is that sleep has been reported by individuals in this community as a very common, very significant impact to quality of life. And I think that's something that's really like under-recognized and underappreciated. And that's a perfect example of the importance of patient-reported data initiatives to be able to bring forward, here's what's important to us and what we think that the medical community and the research community should be looking at. The one below it is just as important, which is digestive. So I know that many years ago, the Usher Syndrome Coalition had a study that we supported where we were trying to understand what's the real prevalence of digestive problems in individuals with Usher syndrome, because we had been hearing lots of anecdotal evidence that this was true. The problem is that if you design a study specifically looking for a particular symptom, and then you go out and you ask people, would you like to participate in this study to determine whether or not individuals with Usher syndrome have digestive issues? People with digestive issues, I did it again, are the people who are going to respond, right? So it doesn't give you this picture sort of across everyone. And so this enables us to do that, to really say, like, of everyone, here's the true percentage who have these symptoms. Okay, so I already told you that the diagnosis survey is the number one most important thing. So after, once you enroll, the most important thing that you can do in there is this, because it is the number one most requested data by researchers. There are a couple of interesting things that have come out of this so far. One of this is the age of diagnosis ranges in this particular community from less than 3 months to 61 years, somebody not getting diagnosed until 61 with Usher syndrome. 20% of individuals say that they were diagnosed as a follow-up to newborn screening. And that's split, actually, 50-50 between Usher syndrome type 1 and 2. I think that'll be interesting to see as the data set grows, if that continues to be true. But that certainly tells us that the follow-up to newborn screening is getting better. I need to move on because I'm running a little low on time. So that's there. If you are already signed up, you should be able to find it very easily toward the top. I want to talk for a moment about genetic test results. So we, within the platform, we do collect genetic data in a number of different ways. We ask that if you have your genetic test report, you upload it. It's super easy to upload. Sometimes people will have a printed copy and they even just take a picture with their phone and send it to us. Whatever, we can take it. We have a genetics team that curates that data and makes it available for the researchers. If you don't have a copy of your genetic test result, if you live in the US, you should be able to get it from the doctor who ordered testing. Many countries outside of the United States, it is not standard to give patients a copy of their genetic test result. But for example, in the UK, every single person who undergoes genetic testing gets a report from the doctor that describes the result of testing. So it's a letter from the doctor. We can take that too. Whatever you have, we can take it and curate it from that. And I think I put in an example here of why this is so important. So when ProQR was just gearing up to get started with the clinical trial in USH2A, and it was specific only to patients who had genetic variants in exon 13, and I was practicing via telemedicine then, and we got lots and lots of inquiries from people asking, like, how do I know if I have a mutation in exon 13? I can't find it. I don't know where to find that. I don't know what that means. But our team will find it. So upload your results, our team will find it, and we're actually looking at partnering together with the Usher Syndrome Coalition and with THEA, who, of course, took over the program from ProQR, to be able to partner together to identify individuals who might be candidates for that upcoming study. As a side note, we would never just hand over a list of patient names of people who might qualify for a study. We would always contact you directly and then put you in touch if you were interested. So that's the second most important thing to do if you're in there. So very briefly, I did want to mention we do collect quality of life data. As this initiative grows, we're looking at adding other types of data as well. The quality of life data, there are some interesting things that came out. there's a question, are you limited in any way in any activities because of any impairment or health problem? This is a CDC quality of life data survey. 80% of people said yes, and most of those report it's due to their vision loss. That's not a surprise. 37% of people, though, said that they needed some sort of help with day-to-day routine tasks. So what we see, I think in this community is a ton of resilience, which we know people who are pretty significantly impacted but have found ways to be independent and do so many things themselves. I was really gratified that, we don't see very high rates of depression, at least so far in this study, though that might be a bias toward those who are currently enrolling. So we want to make sure that we, as the coalition, really support every individual in the community to become part of the effort and to make sure that the data we collect is really representative across everybody. I am out of time, but I really want to tell you what's next very quickly. So the Usher Syndrome Coalition and RareX, we together are working with a larger group of patient advocacy organizations across related rare disorders of vision loss. So other inherited retinal dystrophies that are very rare, Leber hereditary optic neuropathy, and other types of optic nerve disorders that are very rare, to identify ways that we can pool resources, that we can pool together talent, and that we can really work together toward meaningful therapies and just improvements for daily life for individuals with these rare conditions. As part of that, we are working on trying to obtain some grant funding to do some really pretty big projects to significantly advance this data collection initiative. So essentially, this project will grow as we go. Okay, so this last is how to get started. So the one on the left is for most people in this room. So if you haven't gotten started within the data collection program and you're interested, the QR code on the left is how to get started. It will take you less than 2 minutes. It will take you less time than for me to sit down and for the next presenter to start, to sign up. And then you can follow up later to do the full informed consent. And then the other one, oh, sorry, I thought I put the researcher one. Both of these are important to everybody in this room. The other one is the USH Trust for the Usher Syndrome Coalition to make sure that you're really staying in contact. So anybody not in the USH Trust, that's what the second one is. And any researchers who want access to the data, just come and find me and I'll give you that separately. Thank you.